Celiac disease. Refer to the Pediatric Board Study Guide 3rd edition for the latest updates on gastroenterology. This is a 6-year-old boy with Down syndrome is complaining of intermittent abdominal pain, failure to thrive. His blood work is significant for iron deficiency anemia. What is the best next step? A. IgA and tissue transglutaminase IgA antibody levels, iron level, stool culture, urinalysis, occult blood in stool. The correct answer here is IgA and tissue transglutaminase IgA antibody levels screening for celiac disease. Children with Down syndrome are at risk to develop celiac disease, and they have to be screened once they start to have symptoms like abdominal pain and failure to thrive. Gluten sensitive enteropathy or celiac disease is because of a small intestine mucosal damage secondary to exposure to a specific dietary protein, usually from wheat products. Wheat products, for example, like cereal grains that includes wheat, rye, and barley. Pure oats are not considered an offending agent. Very important to know the associated diseases with celiac disease. This is a high yield, like diabetes mellitus type 1, Down syndrome, Williams syndrome, Turner syndrome, Hashimoto thyroiditis or autoimmune thyroiditis, selective IgA deficiency. Clinical presentation of celiac disease: diarrhea. This is the most common symptom. The stool will be pale, loose, and offensive smell. Abdominal distension, failure to thrive, anorexia. Some children, they present only with constipation. This is a summary of gastrointestinal manifestations of celiac disease. Abdominal distension, diarrhea, can be chronic or recurrent. Abdominal pain, this is the most common manifestation among most cases of celiac disease, abdominal pain and discomfort. Failure to thrive, not all children with celiac disease they have failure to thrive. Some of them, they have normal body weight or even high body mass index. Anorexia, vomiting. Constipation can be the only presentation without diarrhea, and this can be misleading and delay the diagnosis. And weight loss, not all the kids they have weight loss or failure to thrive. Some of them, they have normal body weight. Other important manifestation: muscle wasting and loss of muscular power, hypotonia, dental enamel defects, short stature, delayed puberty, osteoporosis, persistent iron deficiency, anemia. Celiac disease can cause dermatitis herpetiformis, which is scattered blisters and burning sensation all over the body from the gluten sensitivity. And on biopsy, you will see granular IgA deposition along the subepidermal membrane. And the management of this case, dapsone. Oral dapsone will cause dramatic response and relief of these symptoms. The best screening test for celiac disease is total IgA level along with anti-tissue transglutaminase IgA, not IgG, IgA antibody, both together. In case if the patient has IgA deficiency, this will give you false negative in case if the patient does have the disease. So if the patient doesn't have IgA deficiency, you will see this one normal level, IgA is normal level, and elevated anti-tissue transglutaminase IgA antibodies in case of celiac disease. This is the most sensitive and specific diagnostic blood test, but is less sensitive in children less than 2 years of age. Another test option, which is not widely used, anti-endomysial IgA antibodies, is laboratory dependent. Another test option for young children less than 2 years of age is deamidated gliadin peptide. Deamidated gliadin peptide. The definitive test is duodenal biopsy. The definitive test is duodenal biopsy. This is a histologic feature of a child with celiac disease and is showing here marked villus blunting and cryptohypoplasia and an increased, as you see here, a lot of lymphocyte, interepithelial lymphocytes. Once the celiac disease is confirmed with the biopsy, we start lifelong exclusion of gluten. You cannot start that with the lab only. You have to have confirmation with the biopsy. And then you start a lifelong exclusion of gluten. No wheat, no barley, no rye in the diet. And follow up with tissue transglutaminase level every 6 months. The better the restriction, the lower the antibodies will be. And follow up with dietitian is very important for vitamin supplementation like iron and other vitamins. And follow up the growth curve to make sure the child is thriving and no weight loss. This is the end. Thank you.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review Series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple-choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams!